Hey everybody, it's Dr. Eric Balcavage back for another edition of the Thyroid Answers Podcast. And we have a returning guest. His name's Reed Davis. He's a board certified holistic health practitioner, certified nutritional therapist, and he's the founder of the Functional Diagnostic Nutrition educational company, I guess is the way to say it, Reed. Am I saying it the right way?
Yeah, I teach a course in functional lab work as it applies to all natural drug-free therapies.
Awesome. So it's a pleasure having you back on the podcast today. I think maybe some people may not have heard our conversation the first time, but we'll start with just give a quick background on your story, how you got into this kind of functional medicine space. And then we're going to get into the topic at hand, at the state of functional medicine today, the challenges within functional medicine, and obviously there's pros to functional medicine, but some of the challenges that may be showing up in functional medicine today, so we can help guide some of the people that are looking for true functional medicine, find the appropriate type of practitioners. Okay?
Fantastic, yeah. So I was actually in the environmental law and conservation field. And, if you see enough dead fish and dead birds because of the environment, you start to wonder, what about people? So 25 years ago, I changed careers. I just went from that field into what about people? I started working at a clinic. It was actually a place where my son was seeing a chiropractor and massage therapist. He was a high school athlete, top of the game, says his dad. And so I was just getting him, and I loved that place. I loved this wellness center. Every time I went in there, I listened to the doctors and therapists and learned about innate intelligence of the body, and that we should be able to maintain that homeostasis that you've talked about so much, if everything was quote unquote normal. Anyway, so I started working there and I started running labs. I just was lucky. I was so fortunate to be in the company of these great minds and true old. They call me an OG now. I thought that meant old geezer. I didn't know what they were talking about. But the original gangsters were these doctors who were creating their own labs because there wasn't enough lab work. And all of our patients there, what I learned real quickly, had already been to 6 or 8 practitioners and weren't better yet. And coming from, the law field, and being a people's advocate and protector of sorts, I thought, wow, what a ripoff. What do you mean you've been to 6 people and aren't better yet? So I learned to run these labs, and I never tried to diagnose or treat anything specifically because, I knew that was for doctors. Well, I'm not a doctor, and I had a lot to learn, Dr. Eric, but I had nothing to unlearn. And that is part of what I think is the problem today, is we'd have to get a lot of practitioners to unlearn, what the diagnosis and treatment model, and look for the underlying causal factors instead. So bottom line is I spent 10 years there running thousands of labs for thousands of people. And with the great mentorship I had, I was also able to make my own observations. It's just a volume of work no one else was doing. I was told by one lab that I did more lab work than their top 5 doctors. They're put together. And so I just loved doing it. And I discovered some patterns and things. So that's my background. I finally started teaching after 10 years, just to expand the reach. Like I could only see so many people in that office. So everyone said, you got to teach other people. I started that, and that was in 2008, so a long time ago, and we've developed now a whole community. First class I taught, Dr. Eric, they wouldn't go away. So I created an alumni, and now it's just snowballed into this great group of people. We're in 50 countries, teaching lab work as it applies to self-directed, all-natural, drug-free, taking charge of your own health. Last thing I'll say is that we basically teach people how to live themselves out of the problems they've lived themselves into.
Yeah, and I agree with that philosophy. I mean, it's the foundation of my book. In my book, The Thyroid Debacle, that I wrote with my friend, Dr. Kelly Halderman, the third part of the book is all on what we call the fitness factors: dietary fitness, emotional fitness, physical fitness. And we purposefully did not put any supplementation recommendations in the book. And people were like, hey, where's the protocols? Where's the strategies? I'm like, the protocols and strategies revolve around improving your level of fitness in these categories. If you have a higher level of dietary fitness, you're going to probably be healthier. But these are the things. The supplementation is a strategy, which it should be. It isn't today in much of functional medicine, it's my belief. But supplementation should be there to kind of help get us there maybe a little bit faster. But if you don't have those foundational principles, high level of sleep fitness, high level of respiratory fitness, high level of emotional fitness, high level of physical fitness, how do you think those supplements are going to work?
Yeah, that was actually the first area I studied, and it was fascinating. I became a nutritionist working there. I really did a lot of training. I have about 15 different programs I completed for a certificate or something. And the first one was nutrition, Certified Nutritional Therapist. Well, what that meant at the time, again, started 25 years ago, was substitute supplements for the drugs that they were on, if reasonable. You can get there here with this. You know what? People would spend $400 or $500 on supplements, and within 2 months, either they would quit taking them and quit coming in the office, by the way. Why? Because either they worked they felt better, so they thought they'd cured themselves. They didn't realize that once they stopped taking them, they were going to go back to their old, because they didn't do anything else that was involved, to your point. Or they didn't work at all and they quit taking them for that reason. So they quit after 2 months. No one would spend another $400 on supplements. So I knew that wasn't going to work long term, and started studying what you just alluded to, all the other things. And that's my bone to pick with, let's say, standard medicine, as well as a lot of functional medicine practitioners. They're still so hooked on the diagnosis and treatment model because of the way payments work, reimbursement and all this different stuff, that they drop all the entire picture. They're not holistic enough. And so I came up with, I had to tell Mrs. Smith and Mr. Jones, who were coming in the office, it's not what you do in the office that matters. It's what you do at home that matters. And what is it? Well, the supplements were part of it, but it was more the diet and the exercise and the stress reduction. And then, so we call it diet, rest, exercise, stress reduction, and supplementation is last. It's the last thing. You can't supplement your way out of a poor diet or no exercise or too much stress or any of these other things. They're good for, I think everyone should take them. This is what I'll wrap up supplements with. Everyone should take them because there's not enough nutrition in food anymore. The food quality is so poor. Even if you're eating organic's good because you're not getting the pesticides and herbicides and rodenticides and whatever they're spraying on the stuff and the crops. Some of it really toxic. But you're also not getting the vitamins, minerals, essential fatty acids, amino acids, the phytonutrients, trace elements, antioxidants. They're not in food anymore to the degree that they need to be. So we take supplements to substitute for what's missing. And everyone could benefit from a vitamin mineral protocol, just daily, But we also use them, to your point, too, for supporting weak areas, because we run labs on everybody, so we know their healing opportunities. It could be digestion, could be the adrenals and energy, and also the immune system, of course, needs to be stimulated here and there. And then finally, self-treatment. You don't have to take harsh drugs to get rid of certain bacteria or funguses or things. Even viruses can be handled with over-the-counter stuff, but for the most part. So we use supplements a lot, but we don't think that they're the whole answer, obviously.
I don't think they're the whole answer. I mean, we could rely just on, I've got patients coming in taking 140 plus capsules a day from other practitioners or what they've self-done. Yeah. And they say, listen, I need all these things. I'm like, that's my first question. Like, why are you taking all this stuff? Well, because I
Right.
need it all. It makes me feel better. I'm like, well, you already feel terrible. That's why you're coming to see me. So maybe some of the excessive supplementation is part of the problem. No, it makes me
Absolutely.
feel better. Well, if you need 140 capsules a day to feel as bad as you do, you don't need any of them. And so
Yeah.
we need, I think there is like a wellness level of potentially of supplementation, good digestive enzyme, maybe some type of multivitamin, some type of organ-based support,
I
maybe
like
some
that.
electrolyte, maybe some creatine, right? Whatever that is for the individual, and that can be tapered. But that's maybe a foundational supplementation to support a healthy whole food based diet
Yes.
and their unique lifestyle. But if you're taking 20 different bottles of supplements per day or 15 bottles of supplements day in, day out, year after year, that's not a functional medicine strategy. That is greenwashing of medicine. If you replace 4 medications with 20 supplements, it's not less expensive. It's not necessarily healthier for you. And you still haven't addressed the root issue, which is why do you need all this stuff? Because if you have 25 nutritional deficiencies, then you've got a quality of food issue, you've got a digestive issue, you've got a malabsorption issue more than you have a micronutrient. The reason you have the multiple micronutrient deficiency is because of what you're eating or how you're breaking it down or digesting it or the state of your gut health, not the fact that you need 20 individual supplements every day, right? So
Absolutely.
that's my standpoint. So let me ask you this question for the listeners, because this is a lot of people come to this podcast because it's the Thyroid Answers podcast, but I think sometimes people they've been in the allopathic world, they come to functional medicine and they think that, hey, the drugs aren't getting me there. Drugs are bad. Supplements are going to fix me. And I say this a lot, that that's not truly what functional medicine is. But
Mm-mm.
I want to give you some time. Like, how would you describe the difference between what allopathic medicine is, which there's a benefit of allopathic medicine, contrary to, you know,
Absolutely.
some people, but there's a benefit to allopathic medicine, but they do or should be doing a different job than we do in functional medicine. So how would you describe the difference between functional and allopathic medicine, so that when somebody comes from an allopathic model and they're looking for a functional medicine practitioner to help them, what should they be looking for in a functional medicine practitioner to know that they've got somebody who doesn't just have a shingle that says functional medicine practitioner,
Right.
but actually practices functional medicine?
Yeah, it's a big question. And a little bit of background for a second. I've seen what I started doing, which was completely alternative. It was considered witchcraft and, quackery and things like that. But because so much of what we did was helpful and worked, it became complementary. So I've seen this evolution from alternative to, well, complementary. It could complement what we do in standard medicine. And then it became integrative, where now people are expecting it. We do such a good job in alternative field of, the way we work, underlying causes, conditions, and things like that, that people were demanding it to the point where functional medicine evolved out of that because of consumer demand. It's like I've always found medicine to be pretty market following, not leading so much. I think in the alternative world, we're the true leaders because we're out of the box. We're looking for alternatives, as the name indicates. So I think functional medicine has not finished evolving. I think it will evolve into I call it intellopathy. It's an intelligence gathering process where you really look at all of the causal factors. And this is the answer. What you look for in functional medicine is someone who truly does that, looks for all the causal factors. They want to know about mental, emotional stress, psychospiritual stress, physical stress. Like I have a lot of that because I have a well-used body. I had motorcycle accidents and lots of sports injuries from wrestling and kickboxing and things like that. My body's beat up. But so you have the mental, emotional stress, you have psychospiritual stress. That would be no purpose in your life. I think that's a horrible state to be in, and it's very unhealthy. Then the physical aches and pains, and then remember where I started, it was with the environment. Environmental stressors are ubiquitous and they're kind of hard to sort out sometimes, but they're there, and new tests are being developed to help us sort this out. So my assessment of functional medicine is that it's getting there. To your point, a lot of doctors, standard medicine practitioners, they want to help people, they care, but they might end up going to get their continuing education credits, the relicensing units and things like that. They'll go to, I'll pick a functional medicine training program, and they go for a weekend or a week. They get enough hours to get their relicensing credits and things like that. And they come back to their offices. They still have the same payer, it's insurance companies sending them people with snotty noses, and they're going to write a prescription and send people on their way, because that's how that system works. They're literally handcuffed to that system, in my opinion. Unless they know how to go rogue, in a sense, cash practice, and I know doctors have given up their licenses because they want to do what they want to do. And man, you could really open up a can of worms going down that discussion. But back to what is functional medicine, or what should it be? It should always be about looking for the reasons you feel like crap and trying to minimize the diagnosis and then the standard of care treatment protocols, unless it's really a downward spiral that's very contracted and you need to do that. So these things should work hand in hand. For us, I practice what's called Functional Diagnostic Nutrition. It's a certification course that I teach, and it's about finding all the underlying reasons. Remember, I didn't have a license, so when I started working at the clinic, I couldn't diagnose and treat, and no one wanted another darn diagnosis anyway. What's really wrong with me? And I don't know. Well, let's run some labs and find out. And over this 25 years, lots of labs have been created now that we can look for the causal factors way upstream. And here's something you don't hear many other places. I may have said this the last time you interviewed me, because it's so true. All these causal factors, some of them very far removed from the underlying causes or from the symptoms, they're causal factors, and they're having an effect on each other. So, you can't singly measure the effects those causal factors are having on each other. You have to look at all the points, all the dots, if you will, connect the dots, and what you've put together is a way to resolve what I call metabolic chaos, the metabolic chaos that exists. So I want to just go back. So, well, there's that system, which is what I do, but that takes time. You recognize all of these things that really need to be worked on. You're not picking out one, oh, your thyroid's off, your hormones are off, your immune system's off, your digestion. You can't pick one thing, because then you leave the person abandoned as to what they really need to be doing. All the lifestyle and epigenetic factors have to be brought in at some point. And so that's what our DRESS system is. It's the diet and the rest and the exercise and the stress reduction in every way it could be identified, known or unknown stressors, and then the supplementation. That's a legitimate holistic plan to get you out of the situation you're in, which is what you've lived yourself into, as long as, and this is where the licensed practitioner and people trained in diagnosis can identify the contracted downward spirals. So if a downward spiral is so contracted that the observations we make can't be capitalized on, because they take so much time to heal, use the innate intelligence of the body to heal. Well, that's what you need allopathic medicine for. If you have a gunshot wound, you're not going to go to your nutritionist. If you get off a plane from West Africa and your temperature's 105 and you're bleeding from your eyeballs, Ebola virus, you're not going to call you're not going to call me. I'm going to send you right to the hospital. So when the downward spiral is really contracted, you need standard medicine to get you out of the fire in the woods and the stuff, save your life, and they're really good at it, man. You go in there and they'll fix you right up and, at least get you out of the woods, we say. Then you need the functional diagnostic nutritionist, what I train people in, to handle all the lifestyle factors, all the epigenetic factors, which are, going to help heal the chronic condition.
Yeah, so let me see if I can summarize that and you tell me if I'm on the right page. So from a functional medicine perspective, in an allopathic perspective, we're focused on what's the disorder, what's the disease, what's this thing that needs some crisis management, and let's deal with it. And for the person who just wants to manage the situation, that's where allopathic shines. The
Let me
difference in
step in
function.
right there and say yes, because those physicians are trained in how bad that downward spiral can get. They know the worst thing. If you
Right.
say you have a pain in your head, they might scan your head for a brain tumor, because that's how bad it could be. But
Right.
most of the time they don't find one. Well, then what? They're just going to prescribe medication for the symptoms. So
Right.
you're
So
totally on it.
So their diagnosis or symptom management focused, right? It's acute crisis type care. But the difference in what functional medicine should be about is you have a headache. It could be caused by 27 different factors.
Hundreds.
We're going to try and look at all these different aspects of your health and try and figure out which ones, it's usually not one, but which ones of these are contributing to developing this excessive stress level that's triggering this type of symptomatology. We're not trying to treat the symptom. We're just saying that headache is an indicator there's a problem. Now we got to figure out what's driving it. Is it an infection? Is it malabsorption issues? Is it emotional stress? Is it a combination of these factors? We're not trying to treat the condition. We really don't care what the condition is labeled. We want to understand what is not as healthy as it needs to be in your system and address that. And if we fix the excessive stressors, now the body can start to heal, recover, and adapt, overcome, and eventually regenerate. But I think what people mistake functional medicine for is a non-drug way to manage their condition. And so they say, I don't want drugs. I'm going to go to this practitioner. They're going to do functional medicine. And they're thinking that the supplements are going to fix the same condition or have the same level potentially of benefit that these really highly potent pharmaceutical drugs can do. And sometimes are disappointed that it doesn't have the desired effect. The problem, and I think this is really important for the listeners, is that just giving you a bunch of supplements and not addressing the things Reed was talking about, the diet, the lifestyle, your emotional state, how well you sleep, your respiration, how well you breathe, all these different, your environment, how toxic an environment are you in, right? If you don't change the terrain, if you don't change the environment, taking a bunch of supplements is just a Band-Aid. Yes, you may feel better. You could take bioidentical hormones instead of prescription hormones, but you're not fixing the issue. Because from my philosophy, and Reed, you can tell me where you stand on this, I often don't believe that the body is broken initially. I think it's adapting to the excessive stress response. So we talked about this a little bit offline, and my challenge for people is that we typically operate in one of two states. We're either in low stress homeostatic regulation, where we can pretty much manage all the stressors that come at us and be able to adapt to them. Or we're in allostasis, which is an excessive level of stress, and we can't regulate the full physiology with that load of stress on. So we have to make choices. Our physiology makes choices. What do I downregulate so that I can deal with the stress? And unfortunately, in that state, we should expect to feel signs and symptoms and health challenges because we're not in a homeostatic state. But I think sometimes practitioners and the patients themselves don't realize there's these two different operating modes. And we want to take a supplement or a drug and expect it to work as if we're in homeostasis when we're not. And so then we're shocked or surprised. Like, hey, I gave you thyroid hormone T4, it should convert to T3 and you should feel great. And then people are shocked when, hey, I took T4, it only felt better for a little bit, and now I don't feel good anymore. Why? Because your body was already decreasing the conversion of T4 to T3. Did you think more T4 in the system was going to fix it? Oh, I didn't even think about that. My doctor didn't tell me that, right? And then we've got practitioners are saying that our clients have forgotten how to convert T4 to T3, or they no longer can do it anymore. So we have to give them T3 to fix them or to optimize them. And then they get a hit of it, they feel a little bit better. And then that their dose up, and they still don't feel well. And they're like, why doesn't this not work? Because you can't optimize a system that's in allostatic regulation to a homeostatic state. You can manipulate the blood levels, but you're not going to restore somebody from allostasis to homeostasis if the same stressors are there that caused the allostate to begin with. That was a long question, but
I get it.
Where's your thought process on that?
You helped me out earlier by summarizing a little bit, and I could do that for you on what you just said. We look at it as there's different stages of care, if you will. So there's relief care, and then there's corrective care, and then there's maintenance. So most people go into the doctor for relief. Matter of fact, they've already been doing, self-medication for a while. That's how we're trained. We're trained to get out of symptoms, get back to no symptoms. You're tired, get back to no symptoms. Does that mean really healthy? No, it just means no symptoms, right? And so I want to summarize, like I said, especially around the thyroid, it's such a classic example of the difference between allopathic, which is relief care, and corrective care, which is what functional medicine is supposed to be focusing on. So let's say you're under a lot of stress, which I consider the root of all evil. In a sense, physiologically, it's some form of stress. We mentioned earlier the, mental, emotional stress, psychospiritual stress, physical stress, and chemical stressors, biochemical, any kind you want to talk about. Well, yeah, that all has an effect. Your body responds the same to each of those. It doesn't differentiate between a punch in the nose and someone yelling at you. And it's just going to respond with that cortisol, DHA imbalances. You get catabolic, and then there's a downward cycle from there, downward spiral that affects everything else in your body. And these little ripples, if you will, flow throughout. When it comes to the thyroid, people go in with symptoms. So they might be the classic cluster of symptoms for thyroid. You can add something to it. You're tired, fatigued, you're overweight and can't lose it. Your hair's thinning, you have cold or numb extremities, and you're constipated. You feel sad. So that would, it sounds like thyroid. So sounds like thyroid. That's the sounds like method, which we don't like. And then, so that practitioner would say, well, it sounds like thyroid. Let me run a thyroid test. Yep, sure enough, TSH is high, T4 and 3, if they measure both, are low. Here's your substance, a little jar of something, screw on cap. Take that, come back in 3 months, we'll see how you're doing. And then they titrate the dosage to make sure that T3 and TSH comes down, T3 goes up, if they're measuring both. And that's what we call treating the paper. Now, it might actually abate, some symptoms may abate, but if it does that, is everyone happy? No, you've still got all of the reasons that your thyroid's low in the first place. And people aren't even asking their doctors, well, what's wrong with my thyroid? And most physicians that I know who are allopathic would say, well, it's idiopathic. We don't know why. But here's your medicine. Let's see if we can get that paper to look good next time. And sure enough, the paper might actually look, you get all those numbers. People still feel like crap, though. So either the same symptoms are coming back, what we mentioned, or new symptoms appear. And the same approach would be what you mentioned, the next thing, the sex hormones, which is the next domino to fall in a stress situation anyway. After you get catabolic, sex hormones are the next thing to go. And so now you go, well, I've lost a few pounds, but I still don't have very good energy and can't build muscle in the gym. Oh, that sounds like method testosterone. Test that. Yep. Pat myself on the back some more. I found your new problem is testosterone. Now they're on another medication to get the test results into where they think they should be. So that's again to us treating the paper. So what's the other approach? Well, realizing what thyroid does, what it's there for, how it's created, how it's used by the body, by the cells, and what are all the influences in between, which are not just thyroid. There's nothing wrong with people's thyroid most of the time. You could have an autoimmune disorder. There's Hashimoto's and there's Graves and things that we'll set aside for a second. So setting aside autoimmune, why would someone be hypothyroid? Well, thyroid is an organ that creates T4 and a little bit of T3.
Mm-hmm.
Most of that T4 is converted in the liver to T3. So conversion could be off. You might just not be converting it. You need selenium, you need enzymes and things and that's just what happens in the liver. There's another huge part, about 25% of your active thyroid is converted by bacteria in the gut from T4 to T3. So if your gut's off, you're going to have low thyroid symptoms. You could even go farther upstream and look at the hypothalamus, which is what tells the pituitary to tell the thyroid to make. So you have from the hypothalamus, you have what's called thyrotropin releasing hormone. That could be off from stressors, chemical, environmental, all kinds of things. So your hypothalamus isn't even telling the pituitary to send out the right signals to the thyroid. Now, the pretended is then you are at the pituitary level where it has to send out its thyroid stimulating hormone to the thyroid. And that could get all jacked up from guess what? High cortisol, stress, all those things have an effect on this, what stimulates the thyroid to make thyroid hormone in the first place. So there's all these steps. Now, you can also have problems with the transcription and things in the cells that affect thyroid's ability to have its effect on metabolism. So there's like at least 11 different ways that there's nothing wrong with your thyroid. It's the signaling, and then it's what happens once it's produced to make it usable by the body, the thyroid hormone usable. So, I mean, this is what I teach, is the anatomy and physiology and biochemistry of thyroid and adrenals and gonads and all these other things, digestion and the immune system and detoxification. And so if you don't have a good background in that, you can't even work at the functional level. If you're not trained in functional level, if you're only trained at the diagnostic level, which is, oh, thyroid's low, here's your thyroid hormone, or even a natural supplement. People love Thyroid Gold and Armor Thyroid and these others that are more natural thyroid replacement. You're not dealing with the underlying causal factors. So if you're trained at the diagnostic level, which most functional medicine practitioners are trained at, with a desire to try to get into diet and lifestyle, that's good. But they're really not trained in the actual what's all upstream, what the real details of how many different things can screw up thyroid expression in the body. So it's I want to say it's as simple as that, even though that's
so the
not simple.
challenge for the listener, there's so many factors that influence thyroid hormone production. But I agree with there's a couple things I agree with what Reed said, and there's one thing I'm going to put a different opinion out there. But either if you have low thyroid hormone and you have an elevated TSH, what would cause that, right? If the thyroid gland is not producing enough thyroid hormone, it's either been damaged medically, radiated, damaged that way. There's immune-driven damage, and I hate the term autoimmunity because that assumes that the immune system has lost control. And I don't think in most cases it's an immune system out of control, because if it was just an immune system out of control, then we shouldn't be able to recover. And as a person who's had Hashimoto's and doesn't, and I've been doing this 30 years, we see people recover all the time. My philosophy based on the literature is that hypothyroidism is often a protective response to the stress response. So when there's stress at the cells and tissues, there's an active downregulation of thyroid metabolism inside the cell. Multiple reasons for that. One, we want to reduce transport of nutrients across the cell barrier to kind of prevent providing nutrients for whatever the threat is. We want to stiffen cell membranes, and we want to reduce the mitochondrial production of energy for a very important reason. And Reed, I'm sure you're familiar with this part of it, but for the listeners, we take in food energy, we convert food energy to cell energy in something called our mitochondria, and that drives the physiology. And if the process of doing that creates exhaust, we call it free radicals or oxidants. And the cell, the good news about a healthy cell is the cell makes antioxidants, and it's set up to make antioxidants to balance out the oxidants that are made through this whole mitochondrial process. But when we have a cell threat, inflammatory, infection, whatever, the cell needs to upregulate its free radicals as part of the defense response. And if we increase free radical production as a way to deal with the threat, and we have the free radical production from the mitochondria still going at full tilt, we'd exceed antioxidant capacity, create oxidative stress and damage. So it's generally being thought now in the literature that this downregulation of thyroid hormone inside the cell is an adaptive response, is part of the cell stress response. There's a downregulation to slow down mitochondrial function and limit the free radical production so that we don't have as much oxidative damage. And somebody might say, well, hey, is that bad? Well, the mitochondria actually then becomes more energy efficient. It actually food energy is converted to cell energy. What we lose in that process, we do downregulate how much we make, but we lose what we call the leakage when we shut down the thyroid hormone physiology. So we lose a lot of this excess energy leakage that we can utilize as heat. If you're cold all the time and you got a thyroid problem, this is one of the reasons why you lose these leakage proteins and these valves. So that's a protective response. The other thing that may be a protective response is when we have these cell stress responses going on, the cells release these danger particles. We call them DAMPs, we call them PAMPs, and the thyroid gland actually has pattern recognition receptors that receive these things. And what the literature is showing is that these particles can attach to these pattern recognition receptors and trigger the thyroid cells to become immune-like cells, actually almost self-destructing, releasing chemicals into the environment, attracting the lymphocytes to come in and create the damage. I know when I was kind of coming up in functional medicine, we talked about the antibodies eating away the gland. That's not really the main focus of what's causing the damage. It's these infiltrating lymphocytes. And so does that make sense? I don't know. Is that what happens to everybody? I don't know. But from my standpoint, that would make sense. And maybe why, when we start to reduce those stressors that you talk about, the dietary stresses, the physical stresses, the toxic stresses, the food stress, the bacterial stressors, that as we improve our fitness factor health, we reduce the stress load, the cells start to come out of that cell danger response, that the immune-driven damage on the gland can settle down and the thyroid tissue can start to recover over time. And why many of my patients need less and less thyroid medication, and some wind up needing none at all. And there was some papers, 2019, there was a huge meta-analysis done. Because if you think about this, if this hypothyroidism is a protective response, what's the downside to providing everybody with a whole bunch of thyroid hormone working against the physiology? If you have a whole bunch of abnormal cells and you provide more thyroid hormone to the body than it wants or needs, what could happen? what does that thyroid hormone could do to bind? It can bind to those cells and support cell replication. If you replicate more sick cells, what do you get? Cancers, right? And so there's been meta-analysis done that people on thyroid medication have a much higher risk of many forms of cancer 5 to 10 years out than people who are never on thyroid hormone to begin with. So I think this is where the research is headed. But I think we need to consider, and I got off track a little bit, but I think we need to consider that many times what's going on with your physiology isn't broken. So my perspective on the functional medicine approach when it comes to thyroid physiology is, if you need some thyroid hormone because your gland has been damaged or destroyed, we should be maxing out at what a thyroid gland would produce. And if you still have reduced conversion of T4 to T3, and you have a functional medicine practitioner who says you're not converting T4 to T3 as well, your T3 is not high enough, we shouldn't be increasing more T3 into that system. The body isn't broken. We need to make sure they have enough T4 and T3 to match what a thyroid gland would have done, but we don't need 70 micrograms of T3 in somebody to try and optimize function. That is not functional medicine approach. That is manipulation from my standpoint to try and force chemistry a certain way. And it can change people's signs and symptoms for a period of time. But I've had more and more patients over the last few years coming to see me from practitioners who keep trying to optimize T4 and T3. They don't care what TSH is. They don't think there's any value there. Just keep giving it so that we keep ratcheting up T3 and it will force the physiology to work. That, to me, is allopathic medicine, not functional medicine.
You couldn't be more right, and I do like to, again, summarize. So there's all these reasons why thyroid would be, you're hypothyroid. And some can have to do with damaged organs and things like that. But considering what the thyroid does, really important. So the thyroid regulates metabolism. Every cell in your body has a thyroid receptor. And pretend that receptorship is working. That's not the problem. It's all the other things that are stressing you out. You're stressed. The body's natural response, this is to your point of adaptation. What would the body do or want to do if you're under a lot of stress? Slow down metabolism to conserve resources. So I'm going way back up to the top and saying that typical average hypothyroidism, if there is such a thing or a way to sort of coin that, is from stress. So your body naturally, an adaptive response, slows down. Either it's the hypothalamus pituitary stimulation of the thyroid, or you go down below the thyroid into conversion and clearance and all these other things, cell receptorship. You haven't even talked about reverse T3, clogging up the receptors and all these other factors. So you get a body that's adapting to stress by slowing down metabolism. And what that results in is you gain a little weight, you're feeling tired. You're, you get on and on from there, depending on how bad it gets, and then into the autoimmune. You don't like that phrase, but it's commonly used to say, well, now the thyroid is actually sort of attacking itself. It's there's an adaptation to the antibodies that are being produced and inflammation and things like that. So I think it's all goes back to stress, and that's what we need to be experts in, is what are the natural effects of stress, and what are the downward spirals that stress creates, and how do we get, go back upstream and get things back to normal, healthy production and regulation of all of these factors like hormones, immune, good digestion, detoxification, energy production. Don't forget nervous system balance. And it really requires, I think, beyond functional medicine's current capability. It really requires a more comprehensive, less diagnostic and treatment-based system. It's where you want to take functional medicine. It's where I want to see functional medicine go. And we'll see how it goes.
Yeah, I mean, don't you don't you think one of the first things we need to consider is what's the state my client's in? Because if we look at, let's say the person comes in and they've got high blood pressure.
Yeah.
It's abnormal, but is it appropriate given the state my client's in?
Absolutely. It's another adaptation. It could be renal. It could be hepatic. It could be just the constriction of the arteries and veins themselves. There's all these things that could regulate blood pressure that are not considered by allopathic, at least. It's just medication. We're either going to slow your heart down, or we're going to reduce contractility of the heart, or something just to get the numbers looking better without even considering why that blood pressure is high. And it's all sort of being written off to genetics.
Right. So we look at that. If we use blood pressure as the example, right? And we'll turn this back to thyroid here in a second. If we would easily agree, and I think most clinicians would agree, giving you a blood pressure medication for high blood pressure doesn't fix the underlying issue. It
Not one bit.
maybe lowers the blood pressure temporarily, but what does a body, if a body is sensing I need more blood flow to my brain, to my extremities, and I knock off one of the mechanisms that's going to help me get increased blood flow to my brain and extremities, what's it going to do? It's going to do it via another pathway, which is why then medicine typically dips into okay, I'm going to give you this beta blocker. That's not working. I'm going to give you this next type of drug. So I'm going to have you on both of these types of drugs to manage the blood pressure. And yes, does it do it? Sure. It still hasn't fixed the problem. And now what is it doing? It's actually creating a second problem. Now I'm not getting blood flow to brain appropriately or to extremities. And what do we see? We see the evolution of things like Alzheimer's, dementia, poor blood flow, and we see the development of neuropathies in the extremities, brain, fingers, toes.
And
Why?
I'm on the exact same page. I mean, not remarkably, but it's kind of simple how all that works. And at the same time, the argument is going to be, well, unregulated high blood pressure is very dangerous, can cause strokes and, renal failure and all these other things. So you've got people trained in diagnosis and treatment who know how bad things can get, who want to intervene heroically with the medication that's going to, again, slow the heart down, reduce contractility, and other ways that those drugs work to get the numbers right, because that will, in their world, extend life and health. But it really isn't health. It's just it's
disease
function at
management
that level. Yeah. And so
that's the point, right?
Yeah.
We need that. We need it.
Yeah.
But that's why we do different jobs, or should do different jobs, right? If I just said, listen, I'm going to give you this supplement. This is a blood pressure supplement, right? It's been shown that this herb reduces blood pressure or whatever.
Berry and all these things. Sure.
But why did you have the high blood pressure to begin with? I fully believe in the innate intelligence, which is, hey, the blood pressure is elevated for reasons: physical stress, chemical stress, emotional stress. Is there blockage? Like, we need to address that. If we take that same thought process to thyroid physiology, if we give somebody enough thyroid medication to manage the condition, just like the blood pressure thing, and stop there, we haven't fixed anything. We're just managing condition. That's allopathic medicine. Problem I see in functional medicine is you have people then going, well, the silly medical doctors aren't looking at T3, and they're not looking at reverse T3, and they're not looking at antibodies. Now, there's a problem, in my opinion, when we just say the person has forgotten how to convert T4 to T3. I don't think we ever forgot. Most of the T4 to T3, originally we thought most of that T4 to T3 was done at the liver via deiodinase 1. Today, we realize that it's not mostly done at the liver and the kidney. Maybe 5 micrograms, 10 micrograms is coming from there. But the bulk or majority of T3 is thought now today to be from deiodinase 2, from cells bringing T4 in, converting it via deiodinase 2, and converting it to deiodinase 3. Deiodinase 1's primary role to make some T3, but its primary role is to metabolize reverse T3. That's the primary role of reverse T3 based on today's science. So people didn't forget, their cells didn't forget how to convert T4 to T3. They've adaptively been downregulated due to the cell stress inflammatory response, because we know that from a science perspective. And it is not reverse T3 blocking the receptors, because the reverse T3 isn't binding to receptors at high levels. That hasn't been shown by science to do that. It's not a mirror image of T3 that it binds there, but if that's sold as the problem, as that, hey, that's your issue, that's why we need to give you massive quantities of T3 to overwhelm inside the cell the T3 reverse T3 docking, when it doesn't really happen. So if we just give T3 more T3 and ignore why the T4 to T3 conversion is downregulated, that is still allopathic manipulation of labs. Yes, it can change signs and symptoms, but there's going to still be a price to pay, and we still have not addressed the underlying issue. I fully agree, as I think you do, we need to manage the crisis situation. That's what medications can help us do. But when we're thinking about how, from a functional medicine perspective, optimizing T3 levels to somebody's preconceived idea that it needs to be at 4 or 5 or 6 for a free T3, that is not functional medicine. That's manipulation. And from my perspective, to get back to the original question, when you're going to see somebody for functional medicine, if their focus is, hey, we're going to optimize your blood levels, and they're not talking about how do we address what the root causes, or we need to identify the root causes, you're not doing functional medicine, even if they have a shingle out there that says, I'm a functional medicine practitioner.
So I agree completely. And there's always advances in some of the science, and I try to keep it simple. I spent a lot of time as the patient educator in a clinic, so I had to be able to explain it to people with sometimes tears in their eyes in a simple way. And at the same time, you got to know the anatomy, the biochemistry behind it and stuff. And that's where we're finding out new things. One thing we know is that treating the paper isn't the way to go about it. And I think that the secret in there somewhere is that it's getting people into that corrective mode where relief care is great and you need it, especially if you're bleeding. You got to stop the bleeding. One doctor friend of mine says sometimes people come into a doctor's office and they need a life jacket. They're drowning. Mm-hmm. You got to get them. But once they're over to the edge of the pond or whatever it is, you get the life jacket off. And now what? You don't want to end up back in the deep end. You got to start changing the epigenetic factors. You got to start eating right and going to bed on time and getting a good night's sleep, exercising appropriately for your fitness level, reducing stress, which is what the hell that means, like 100 things to 100 people. And again, it's not just that mental, emotional, I hate my job, my kids are bad, or whatever it is. It's all the other factors, and not just doing the relief care. So that's where the corrective care, and that's what I think functional medicine needs to get to a higher level of, is more the corrective care. They need to have all the labs being run, not just the one where it sounds like thyroid, sounds like irritable bowel, or sounds like something. So they're using that sounds like method because, they only have 5 minutes with a person and they got to either order a test or something. They'll pick that one. They're constricted by insurance and what it's going to cover and different things. So they really need more of the functional labs. They need freedom to run all the you need to look at hormones and the immune system and digestion and detoxification, energy production, and so on. And when you look at it all, again, then you can connect the dots. So that's where functional medicine hasn't arrived yet, unless they're in cash practices where they can run all the, running the microbiome testing and other looks at the hormones and things. And then hire some health coaches who are highly trained and skilled in and understanding all the physiology so that they can work with that person. Physicians aren't trained in coaching. Some of them have the worst, and I've experienced this sort of bedside manner. You start questioning certain doctors and they'll, piss you off, or you're pissing them off, and they'll throw you out of their office. Like, this guy asks too many questions. I'm that guy. I had something happen. I'm 71 going on 72. Something occurred last winter and I went to my doctor. I'm on Medicare. I go to my doctor. Oh, yeah, I need to refer you to this guy. Go to that guy. He was a-hole. He didn't want to answer any questions. He just wanted me to follow his directions in order to submit to the testing he wanted to do and the procedures he wanted to do. And I'm not going to go see that guy. I'm seeing someone else. But so that's where I see, now he's an allopathic guy, but I mean, if you're converting from that to functional medicine, I think there's a lot to unlearn and to learn and to unlearn. Getting out of the diagnosis and treatment model is going to be really hard for most FM doctors if they really want to go FM, if they want to help FM evolve into a data-driven, getting all the data, a holistic epigenetic approach to health versus treating the test results, which is what you described very well. They just treat the test results. High blood pressure here. If that doesn't work, try this one. Oh, that one made you cough. People get these ridiculous chronic coughs from taking blood pressure medication or some. Same thing with cholesterol. They get other chronic issues, and they're just not looking at enough data and connecting the dots to create a holistic lifestyle program for a person so they can live themselves out of the problems they've lived themselves into.
Yeah. And I think that at the end of the day, foundationally, for the person who's leaving or not necessarily leaving an allopathic model. So I think it's great to have an allopathic physician as part of your team.
Yeah.
But as you're coming to functional medicine, if you're coming, especially if you've got a thyroid condition and you're coming to functional medicine, I think a couple key things are really important to understand. One of those is we should be doing a different job, which is we want to make sure you take the lead. What I call thyroid recovery is thyroid medication you take supports your physiology in a homeostatic mode, and that you need more chances than not, you're going to need less medication and it's going to work optimally. Meaning, I'm going to have appropriate levels of T4, T3, reverse T3, thyroid antibodies, and I'm going to look at the rest of the metabolic panel and not see patterns of hypo or hyperthyroidism in the rest of my labs. Cholesterol levels normalize, sex hormone normalize, blood glucose regulation normalizes. If I take, so that's thyroid recovery. For some of those people, thyroid recovery means they don't need any medication at all. I've seen that over and over the years. As they reduce those stressors, the thyroid gland for some people, the thyroid gland is able to recover. As long as we're not oversaturating the body with excessive amounts of medication, the thyroid gland can recover, but we have to allow TSH to go up to stimulate the thyroid gland to restore function and cycling of iodine back into the system. But most people are trying to maintain an optimal level of TSH. It's got to be in this range. Not true. Not true. Especially in somebody as you get older, right? 72, you shouldn't have a TSH the same as I should have in my 50s or somebody in their 30s. We also have to consider the time of year you're going to get your thyroid panel done. Your numbers are going to change based on the time of the year it is. TSH could be 4.2 because it's January and it's cold where you live. So it could be seasonal changes. So I wanted to ask you about that too, from the training perspective, but I'll just finish with this, is that you want somebody who's going to be looking for what's root causes, what can we change diet, lifestyle, what I call the fitness factors. What can you do on your own without the help of me necessarily to change those factors, because that's really long-term strategy is how do I
Yes.
maintain a healthy diet? How do I maintain good sleep, good respiration, good mindset? And then my opinion, the specialization of medicine is an allopathic thing. In functional medicine, we talk through lenses. I talk through the lens of the cell danger response and thyroid physiology, but I rarely do anything to try and manipulate thyroid hormones other than try to look at all the systems together, try and figure out what's triggering the root issue. So in my perspective, good functional medicine practitioner understands thyroid physiology, gut physiology, sex hormone physiology, adrenal physiology, knows how all these things interrelate. So they're
Yes.
not saying, hey, I only work on thyroid hormone and optimizing that. You're going to have to see somebody else for your sex hormone, somebody else for your gut.
That's so
That's not really
problematic.
functional medicine, right?
Yes. Yeah, absolutely. It's amazing how much is being missed, or by fractionating the body. You have some gut disorders, you got heartburn, gas, indigestion, bloating, diarrhea, constipation, or the famous alternating diarrhea and constipation. And so you go to gastroenterologist, and they might start working on those symptoms, and you might actually make a little progress. But if that patient says, doc, I can't build any muscle in the gym, my libido's low, and say, oh, that's endocrinology. You got to go see an endocrinologist. And so the person, they get a different diagnosis over there and a different medication or whatever. So that fractionation is the problem with standard medicine, and it's supposed to be resolved by functional medicine. And I love how on your sign there it says strategic functional medicine. That's a step in the right direction, that you do need to be able to handle it all. That that the body is, there's an orchestration of all of these things going on, but there's a unifying and simplifying, or I should say simplifying and unifying approach. And it is whole body medicine. And you do have to know, it should just be being taught in medical school that, knee bone's connected to the ankle bone, and this fractionation is what's killing, what kills standard medicine. Everyone's got a specialty, and they send the patient round and around, and it's all what's covered by insurance and who's in the network. And it's upsetting if you think about it, that it doesn't sound legit. Why can't I just go somewhere and some doctor figures out what's wrong and helps me fix it?
Yeah.
So, and it doesn't just say, well, you got to go see someone else for that. You still could use a team. I understand that. I'd like to see a chiropractor on every team, and an acupuncturist, and a nutritionist, and a functional medicine practitioner, along with maybe even surgery is an option at some point. But it should all be based on this very comprehensive, data-driven system, along with matching all that data with a person. Every time I teach a test, here's how you use this test, run this, it's got to correlate with the person. If a test doesn't explain why they feel like crap, it's a useless test. So let me ask you a question, if you would. Are you running more than just your CBC, chem panels, metabolic panels, using that mostly and trying to discover functional ranges within that? Or do you run microbiome testing and, intestinal permeability and all these other things?
Yeah, I run a lot of different testing. I start with a comprehensive metabolic panel because
Right.
it gives us the 30,000-foot view. So I can look at my inflammatory markers, my thyroid markers. I can look at my blood glucose regulation, liver markers, renal markers, and you can get a general sense of what's going on. I know some people like to practice. They like to run a gut test, a hormone test, a comprehensive metabolic panel, a hair tissue and analysis, organic acid, all at the start for people. And I'm like, I can't address all those things today, but I can do that comprehensive blood chemistry panel and get a pretty good feel of what systems are struggling. I know I've got an inflammatory process. I can get a feel of whether since 70 to 80% of the immune system surrounds the GI tract, everything's got to go in, everything's got to go out. If I got malabsorption markers and indications that I got gut issues, I know I need to start with diet and gut function physiology, some potential supportive digestion. And those other things, I already know if they've got liver compromise and they got hormone symptoms, I know they got hormone related symptoms, but I'm not going to run that test today because I can't address it yet. I've got to get these other things in place. So that's why I have strategic on that sign, so that when we look at those things, and then I think the other thing that's really important, and I hope you're teaching this with your students, is I think what happens this happens in allopathic medicine a lot, where we read labs. It's H or it's L, and then we make a decision. Functional medicine has started doing this too. They say, well, we're better because we have a tighter range, and if it's a high or low, that's a problem. No, it's not. Labs need to be interpreted, and for the people listening to this, I say this a lot, but listen. Labs, there's 4 things to consider when we look at labs. A lab value is normal and appropriate, meaning you feel great and all your labs look great. Perfect. A lab value is normal and inappropriate. You're tired, you're fatigued, you're hypothyroid, you look the part, and your TSH is low normal. Somebody's going to say, you don't have a thyroid problem because your thyroid numbers are looking low. You're probably a little bit more hyper than hypo based on the TSH. BS. That is an abnormal, the value may be in somebody's normal range, but it's totally inappropriate for the person sitting in front of me. And a practitioner who's doing functional medicine should then go through their Rolodex in their brain and say, okay, that's not normal. TSH is actually lower than it should be for a hypothyroid patient this is a patient who looks that way. So is there inflammation that would suppress the TSH? Because the inflammatory stress response is going to increase T4 to T3 conversion in the hypothalamus, saturate the hypothalamus, TSH is going to drop in early phases. So if you didn't run inflammatory markers, you can't interpret it. So a person needs to interpret that. The third option is the value is abnormal and totally appropriate. If the person in front of me is sitting saying, I feel inflamed, I'm tired, I'm fatigued, I don't feel good, I have no energy. Yeah. Here's the good news. You do have lots of inflammation based on the tests we ran. It's reducing your T4 to T3 conversion. Your reverse T3 is high. You do have tissue hypothyroidism. The good news is your gland is still producing enough thyroid hormone, but your tissues aren't converting it. You don't need thyroid hormone. We need to drill with the inflammation. And yes, the other reason you're tired and fatigued and you have no libido is because during this inflammatory process, you can't get glucose into the cells to be made into energy. That's why you're glucose resistant, not because you're diabetic. It's because you have inflammation that's reducing transport. And the reason you're getting fat is because if you can't convert that food energy to cell energy, it's got to be stored. That's why you're getting fat. So the good news is we have lots of abnormal findings, but they're all appropriate for what you're struggling with. Now we're going to get busy fixing you. And the fourth option is the value is abnormal and inappropriate. Reed comes in to me, says, I feel awesome. I feel great. I look great. I want you to run my labs and tell me how great I am. And we run some labs and he's got a CRP of 42. That's abnormal and it's totally inappropriate for the person who's sitting in front of me, telling me what they're telling me. Now I've got to rerun that test. And then if it's positive again, I got to start looking for why that we'd have that abnormal value. And I've had that happen many times and I go, all right, we got to start looking for some abnormal things like cancer and things like that. But those are my 4 considerations anytime I'm interpreting lab. That's different than reading labs.
I love it. And, we've said earlier, the symptom isn't the problem, it's the result of the problem. And the test result isn't the problem. This number isn't the problem. It's the result of the problem. So we don't want to just treat the paper. And what you're being, I think, Dr. Eric, is a really good health detective. It's like that's kind of what we're supposed to do, I think, in functional medicine and in this space is be a good health detective, figure out the why. Why is that number low? Not just give you something to get it into some acceptable, range by big white coat, so to speak. And so I've been teaching health detective work for a long time. And to the point about how comprehensive do you want to get in the beginning, what you're doing, running these full panels and stuff is really good. But in the day, a lot of our patients coming in had run blood work and been told
Yeah.
nothing's wrong with you.
That's because they've been
Nothing's wrong
read,
with you. It's all
not
normal.
interpreted,
And
right?
yet they feel crappy.
Yeah.
So that's what made me start running the alternative labs, the saliva, urine, stool, and blood work, of course. And then for quite a while, remember, I worked there 10 years. I ran thousands of labs.
Mm.
And because I had an inhibition about spending their money, this was all out of pocket. None of this was covered by insurance. For one thing, I wasn't a physician. I was just a health detective. And I would run a couple labs, usually hormone, immune, some gut, something like, and then we'd start working on that stuff. And then I'd say, well, we need to run a stool test. I got to look for bacteria and fungus and overgrowth and biofilms and things like that. And then I'd say, well, now we need to run a food sensitivity test, which is another $300 out of pocket,
Mhm.
And I finally had enough people say to me, hey, Reed, how come every time I come in here, you run another test? I said, well, because we're looking at all of the things you need to do. And they said often enough, why didn't you just run all these at once? Like I would have spent the money, like I just didn't want to present them with, $1,200 worth of lab work up front out of pocket. Well, we'll
Yeah.
just here's this test, $150. This one's 200. Can you do that? Yeah. And then, but I had so many say, you know, I don't want to just come in here and run a new test every time. Why didn't you figure it all out at the beginning? So I started running 5 labs
Mhm.
that covered the patterns I recognize. So I started on every person walking in the door. I don't know what's causing your problem. I don't know if your hypothyroid is like real hypothyroid, something wrong with the gland, or is it other stress things like that. So the areas I found were the most common dysfunctional areas, what I call healing opportunities. I've never diagnosed and treated anything. With me, it's just what are the healing opportunities in this comprehensive labs. So we look at hormones, the immune system, digestion, detoxification, energy production, and nervous system. That spells hidden. Hormone, immune, digestion, detoxification, energy production, nervous system. HIDDEN. And you can throw in oxidative stress and some other stuff, but that approach ended up working so well that that's enough comprehensively. There's enough dots there to connect. Remember, a lot of these things are affecting each other ways that can't be measured. So you got to recognize patterns, and that has outperformed what they had been coming in having experienced. Like they weren't getting results with the DXTX, run this blood work. Nothing's wrong with you. Well, you know what? You're sending them out in the street to go try every kind of quackery there is. They'll go to spend 10 grand on standing on their head in the corner with carrots up their nose and, just every kind of thing. So I couldn't do that. I had to run the labs and I learned to run a comprehensive, again, saliva, urine, blood, stool on every person. Throw in hair, as you mentioned, that's a good way to look for heavy metals at least, and some mineral balance and things like that. But those left. So and then because remember, I can't diagnose, not allowed to, don't want to, and none of the patients wanted to. So it was what's really wrong. And then, as I said, hey, coming in the office, getting your therapy and all your things. We had chiropractic, acupuncture, we had a DO, we had a podiatrist, we had other people. And I would tell people, you're not help, that's not what you need. You need to go home and live like this to
Mhm.
reverse what you have built up over the years in your body that is all malfunctioning in all these different areas. That's why I call it metabolic chaos. That's my one diagnosis, if you will, metabolic chaos. And man, you can live yourself out of this holistically, epigenetically, um, unless you need a doctor for some really sort of contracted downward spiral, you screwed something up,
Yeah.
really badly.
Yeah. I don't think I think the tests that you're running, I think there's no problem with them. running any of those tests. I probably run most of those tests on a lot of people. I just don't do them at the start for me, philosophically, because if I run a sex hormone panel on somebody today, and I know I got to deal with their gut, their liver, their gallbladder over the next couple months, their sex hormones are going to change by the time I'm really ready to address it, because I'm very limited. I'm very strategic on supplementation. A few things at a time, layer them in, pull them out, onto the next thing. So for the listener, everybody's got a different strategy, and there are people that like to do stuff in the front, all in, to kind of help you understand the big picture and the complexity of what's going on. I used to do more of that. I do less of that now, and just use my key catchphrase when people say, "Hey, what's going on?" You use metabolic chaos. I say, you've got a multi-system adaptive disorder going on due to excessive stress. You have adrenal dysregulation. I already know that because your cholesterol is elevated. You're going to have androgen and estrogen dysregulation because the cholesterol's in the blood. It's not in the tissue because you got the low T3. You're going to have low blood sugar issues. I already see that on there. And the reason you have blood sugar issues is because of this. You've got mood and anxiety and all these issues because of these factors. I don't need to test them all right now. We will test them later, but I want to test it closer to the time that I'm ready to address that system if it needs to be addressed. So there's just different strategies that go about it. But I do think, and I think this is a thing we definitely would agree on, it's not about running those tests. That's one thing, gives us more data. But I think what separates the practitioner is the practitioner who runs a Dutch test and then doesn't just tell you what's high or low on the Dutch test, but then takes that Dutch test information, looks at your blood metabolic panel and says, "Hey, look, you see this low cortisol? This metabolized cortisol is low for a couple reasons. Let me show you what we see over here in the blood work that correlates with it. Or I see this result on the Dutch test, and it says this, but let me tell you why it's not really low. That your catecholamine metabolites say low, they're not low. You've got decreased metabolism, you've got anxiety. Come over here to the blood work. This is telling us why this isn't really low. You actually have high catecholamines, which is driving your anxiety. You're just not metabolizing things. It's the integration of different sets of labs, pulling all of that information together, not necessarily looking at a test separately by itself, but correlating all those things, because the better we're able to interpret the labs and correlate the findings of multiple tests, the more we're able to kind of focus on, hey, what's the easiest or most direct way to get a result for this patient versus, oh, this is a hormone panel. I don't have to look at your blood work because this is a hormone panel. No. Hey, the low estrogen and testosterone, it's because, remember, high cholesterol? It's not in there, right? So we can really when we interpret those labs and we bring those together, that's what I think really differentiates the beginner functional medicine detective or strategic functional practitioner from the skilled functional practitioner, right? Who's been doing this for a while. And that's not that the newbie is bad, but this is the difference between just saying I'm a functional practitioner, being new in it, and really being good at functional medicine. But everybody starts with the basics and the foundation and the protocols, and I just got to focus on this one thing in front of me. But when we get good and you're 25 or 30 years into this, you can look at blood work and you go, all right, I know the patterns I'm going to see on their blood work. I know the patterns I'm going to likely see on their hormone panel. I know the patterns I'm going to see because I know the symptoms, signs, symptoms, and I got a good comprehensive panel. Yeah, I know which direction I need to go here.
I agree completely. There's sort of different ways to skin the cat. What you're doing is comprehensive, and results are the defining, success metric. If you're getting results, that's what matters. I love that you're doing strategic functional medicine. I think we're really close. Really close, probably doing the same thing. But we would both agree that if someone's just running a Dutch and a GI map and thinks that's functional medicine, they have a lot to go. You have a lot to either learn or unlearn, you know.
Yeah. So I know I've had plenty of your students as clients of mine. I've coached a bunch of your
Graduates or
practitioners,
something.
graduates
Yeah.
who have said, "Hey, I need some more in depth about what you're talking," and help them with interpretation of things. But let's just finish up with some of the really what FDN is about. And if somebody is interested, you know, what kind of sets, I think we've already talked about, but what sets your program aside? Because there's a gazillion health coach programs out there. What sets your program different? And why might somebody, if they're looking for like a health coach or a wellness coach, what might set an FDN practitioner aside from another health coach, maybe from another program?
The level of the training, absolutely 100%. It's so robust. A lot of my graduates are independent practitioners. They're health entrepreneurs. They have a real sincere desire to help others and to do some good in the world. And they want to be independent. So they want to work their own hours and set their own wages and work from anywhere in the world because it's all telemedicine and things like that. So there's a lot of independent um, practice type people who just want the training so they know which labs to run. And we also teach the protocol side, the diet, you know, and how to clinically correlate all the test results with the person. And then we throw in some coaching skills to get them actually follow the behaviors and adopt the behaviors they have to. So Eric, it's like we run the labs. That's step one. And it is comprehensive. That's the approach I recommend. Two is you design the DRESS, individualized for that person. We do metabolic typing. We know what diet would be right, good starting points at least. Exercise appropriate for your fitness levels and things like that. I'm certainly not doing the workouts I did at 25 and 30. You know, at my age, I'm gonna keep hurting myself if I do. Diet, rest, exercise. Stress reduction is really huge because we go again with the labs. It's not just stress. Oh, I hate my job. Meditate, you know, or breathe. And so, no, it's like there's chemical stressors in the environment. We can test whether you wear too much dry clean clothes. There's dry cleaning chemicals that end up in your bloodstream. So you know, all of that, draperies, you know, your household cleaning products and personal care products, and all those that we consider stressors, along with foods. There's foods that you're sensitive to. You shouldn't be eating, or at least not now. And so diet, rest, exercise, stress reduction is just so huge. And the supplementation based on the lab results for the support and stimulation and even self-treatment that you might need for what's there on top of the basic nutritional needs. So that's what I teach. There's no other course like it. It's really, we just were awarded yesterday the top #1 functional lab training program by this big organization and magazine. It's up in Canada, but we are international. We're in 50 countries. So, and also you get me. And I have, you know, a way of teaching, a way of sort of walking people through not what I learned at some seminar, what I did in the office for 10 years with thousands of people. So again, I never thought I'd be a teacher, Eric, but people just kept telling me, you should be teaching, man. You know, or a lab director calls me up and goes, who the hell are you? You know, you run 5 times more labs than our top 5 doctors combined. Like, how the hell are you doing that? You should be teaching that. And I just like doing it. You know, some people smarter than me have said I never worked a day in my life. I just had fun helping people. So I'm a good organizer and really good organizer. And I have organized this system that gives one reasonable expectations. You can help anybody. And it's something that anybody could do because we use at-home lab testing. So it's all direct to consumer type testing. Now you can still get I mean, even LabCorp and Quest and these big reference labs have their own direct to consumer programs. So you could use that. And my overall goal is to solve the first problem I recognized. When I changed from environmental law to working with people, saving the planet, to helping folks, it was the cycle of trial and error, the waste of money, and the fruitless things they'd been doing. I had to be the last guy they needed to see. So I sorted a few things out. I'm still learning. I learned from you today. I mean, really, I picked up some things. Um, but the system seems to work. And that's why I think people should choose functional diagnostic nutrition. It's known affectionately around the world as FDN, because you can find an FDN practitioner in your neighborhood. And we've created a URL people can go to. It's fdntraining.com, fdntraining.com/Balkavash. Hope I said that right.
Close enough.
So that's it. Just go to fdntraining.com/Balkavash and we'll give you something for free. My team switches it around. Sometimes it's a book, sometimes it's a little mini course or something like that.
All right. Well, Reed, I appreciate you being again as a guest. I love the conversation because I think at the root we talk about things from the same perspective.
Yeah.
First time we were going to have a conversation, I was like, I don't know where this guy's coming from. But once we started having the conversation, I think we're both at the root of, hey, we've got some type of self-stress response going on. These are adaptive changes. We need to find the root issues. That's functional medicine. And so I appreciate the perspectives. I will say this, for people who are looking for somebody who's like a health coach, the key from when I have health coaches come to me for help and guidance on their clients, I do find that the FDN practitioners are the most in line with my level, with the way I think about things. And so when somebody asks me, like, if they're interested, they want to go to training, I typically recommend FDN. And if somebody's looking for somebody who's in a health coaching role, I usually say, hey, look, these are the type of people I would look for, because this is the type of training, because it's closer to my thought process and how I process patients. So I appreciate that.
Thank you very much. We love that relationship. A lot of doctors have hired FDNs, and they're the doctor. And that's the, people come in, they could have a really serious problem that's, again, a downward spiral that's contracted. I can't make any observation. The things I can do for that person can't be capitalized until you get out of the woods with that thing. So if you have something like that, this is why we work so well. It is highly integrated with functional medicine. So thanks for the
absolutely. For the listeners, I appreciate you listening to the podcast, sharing it with friends and family. You get a chance, give us a review on wherever you watch it or download your podcast. And who knows, maybe we'll have Reed back on in the future sometime, maybe for his 73rd birthday, and we'll talk about another topic somewhere. Reed, thanks so much for coming on the Thyroid Answers podcast.
My pleasure. Thank you, Dr. Eric.